Hi, I'm Kevin Harrington, an original shark from the hit TV show Shark Tank. And with me is Dr. Gary Rademacher. Dr. Gary, how you doing? Good having you here.
Great, thanks for having me.
So your company, Downtown's Healthcare, Denver, Colorado, amazing marketplace. I love coming to Denver. But you've been 25 years in the business of helping patients, and now for about 10 years, integratively, with an integrated medical clinic. So this transition that you've made has given you the ability to even offer more services and provide more solutions to some big problems that are out there in the marketplace, right?
Absolutely.
Yeah. And so what do you think? I mean, the regenerative side of the business is just exploding, correct? And you've been doing that almost 10 years now, right?
Yes.
So why do you think that's happening? What's going on out there?
You know, I think we're in an epidemic right now, right? I mean, we have people taking opioids. First off, under the age of 50, it's a leading cause of death right now. And so I think that people are looking for other alternatives other than like medications or surgery. Okay,
wow. And so over the years, is there any kind of unique positioning Downtown's, your healthcare practice provides in the marketplace?
Certainly. Someone with any type of joint issue, muscle issue. We've helped people with osteoarthritis of the knees, shoulders, hips. Our medical team is so highly skilled. They've trained over 500 providers across the country on how to do these types of procedures. And so our big thing is like, listen, if other medical providers can trust us, so can you, right?
Oh, wow. So not just handling patients, but you're actually teaching other medical providers how to do what you have created in many cases. So that's pretty powerful. Now, in 25 years, I'm sure you've seen some amazing successes in the last 10 years, even probably more with the new addition of integrative and regenerative. Do you got anybody that's coming off the top of your head? You probably got a few, but let's share some stories with some of the folks listening right now.
Just a couple. I mean, number one, we've had an 84-year-old gentleman who came in who used to be a ski instructor. He hadn't skied in 5 years. 6 weeks post-treatment, he was out there hitting the slopes again.
Okay.
We've had a gentleman who his main goal is to walk his daughter down the aisle, and so about 6 to 8 weeks post-treatment, he was able to walk his daughter down the aisle when he couldn't even take 10 steps without being in excruciating pain. So that's just tipping the iceberg right there.
Yeah, that's great. Now, you've got a wedding coming up, you can't walk, it's easy, I got to call somebody. So that's easy, but when should somebody else that maybe doesn't have something pressing like that, what's the best time for someone to make a call to your office?
Yeah, I mean, before they get on that prescription.
Okay.
Before they're thinking of surgery. We're looking for people who actually want to attack the problem before it gets so bad.
Okay.
We see amazing results for people, better results when they attack it early. So that's when I would say to get in.
The sooner they feel something, then the sooner they make the call, probably the easier it is to resolve it, because maybe it's before it gets ripped or torn or whatever it might be.
Exactly.
Might be happening, right? So so just for those that don't know, like looking, you have a facility with a lot of professionals in there. Walk us through what someone might see if they walk into your place.
Sure. When someone comes into our office, basically they're going to get a warm smile from a great front desk person.
Great.
We have multiple providers. We have medical doctors, nurse practitioners, rehab techs, chiropractors, massage therapists, all underneath one roof. When someone comes in, they're getting evaluated by multiple providers to find out if we can help them. If they're a candidate, great. If they're not, we find out what's going on so we can point them into a good direction.
Oh, great. So for those that are listening, let's give, what kinds of folks should be calling you. So let's just give a shout out to them, because your information is on the screen right now for them to be able to track you down, which is, we'd love to steer customers in the right direction to get some really good help. But who should be calling you?
Basically, anyone with any type of joint or muscle problem, old sports injuries, old car accidents, auto injuries, people who have repetitive stress disorders, someone who's got like neuropathies or fibromyalgias, basically anyone who's looking at avoiding surgery or just does not want to get on medication, call us now.
Dr. Gary Rademacher, thank you so much.
Thanks for having
Denver,
me.
Colorado, and they do a lot of skiing out there, so I bet you that you're probably the go-to place for those that need help to be able to get on those skis and make it happen.
Absolutely.
So thanks for being with us today. Dr. Gary, thank you for being here.
Thank you.
I'm going to recommend you give Dr. Gary Rademacher a phone call. Downtown's Healthcare. Thank you for being with us.